Hey guys, so I'm going to talk to you a little bit about cirrhosis of the liver today. According to my.clevelandclinic.org, cirrhosis of the liver can be described as late-stage liver disease in which the healthy liver tissue is damaged and then replaced by scar tissue. The scarring blocks blood flow through the liver, therefore slowing the liver's ability to process nutrients, hormones, medications, and natural toxins, as well as decreases the production of bile, cholesterol, and certain plasma proteins. Causes of cirrhosis are described by mayoclinic.org, being chronic alcoholism, hepatitis B or C, autoimmune hepatitis, or non-alcoholic fatty liver disease, as well as some inherited disorders such as alpha-1 antitrypsin deficiency, cystic fibrosis, and Wilson disease. Some infection may also cause cirrhosis such as syphilis, and some medications may cause cirrhosis such as methotrexate. Some symptoms that you will see in cirrhosis are going to be easy bruising or bleeding, spider veins on the surface of the skin, yellowing of the skin or eyes, which is called jaundice, and then fluid buildup within the abdominal cavity called ascites, and fluid buildup within your arms and legs called edema. Aside from those symptoms, you may also see light-colored stools and brownish or orange colored urine from the person. Some of the complications of cirrhosis can be pretty severe. One of them is malnutrition. Another complication is called portal hypertension, in which the blood pressure within the portal vein is higher than it should be, causing it to swell. And this can lead to many other issues, one of them being varices. Varices are swollen veins within the esophagus, and these may bleed or may even rupture if the portal hypertension is not controlled, and this rupture can cause internal hemorrhaging. Another issue that arises from portal hypertension is called Hepatorenal Syndrome, which is kidney failure. Another major complication and symptom you will see later in the end stages of cirrhosis is called Hepatic Encephalopathy, and in this you will see mental confusion and trouble concentrating, memory loss, and this is all caused by toxins build up within the bloodstream and eventually in the brain. And so, the National Institute of Health describes some of the testing to diagnose cirrhosis. To begin with, your physician will perform a head-to-toe assessment to look for these physical symptoms that I have previously described, and then they will most likely order blood work to help them confirm diagnosis. And in this blood work, they're going to be looking for increased bilirubin level, increased iron levels, increased liver enzymes, decreased albumin levels, decreased sodium, and decreased blood clotting factors. Along with the blood work, they will most likely order imaging to confirm diagnosis of cirrhosis, and this includes or may include MRI, CT scan, and something called transient elastography ultrasound. And in this ultrasound, they can better measure the fat content and the stiffness of the liver, and the stiffness is going to be indicative of scarring to the liver tissue. And because they're able to get all of this information from the blood work and imaging, they usually do not have to obtain a liver tissue biopsy, but it can be helpful in determining the extent of damage to the liver. Treatment for cirrhosis. So Cirrhosis does not have a cure. The damage to your liver cannot be undone. So the main goal of treatment is to slow the progression of the disease. So this is going to include lifestyle changes such as cessation of alcohol consumption, trying to eat a low sodium, low fat diet, and limiting your over-the-counter drug usage such as ibuprofen and Tylenol, because these will affect your liver function. And medications such as lactulose to help break that ammonia down and get rid of it. This is what your liver normally does. And then procedures such as a paracentesis is where you can have the fluid in your abdominal cavity drained. And this can help prevent infections such as peritonitis that is caused by ascites within the abdominal cavity. And in the end stages of cirrhosis, you may have an option for liver transplant. And so this is only when your liver is failing, but the person has to be also deemed healthy enough to withstand the surgery and maintaining the transplant organ afterwards. And so this is kind of rare that someone actually gets a liver transplant, also because there's usually some waiting list as well. Thank you.